24/7 News on your side in D.C.
This year, the Cleveland Clinic's third annual MENtion It educational campaign, trying to find out why it is how it is, I should say, men and women view men's health.
So it examined overall wellness, comfort level when discussing certain topics, and actions toward better health. And joining us live from the Cleveland Clinic with more on these findings is Dr. Sarah Vidge, a urologist in the Glickman Urological and Kidney Institute at the Cleveland Clinic. We want to welcome you, Dr. Vidge. Good to have you with us.
Thank you for having me.
So as I understand it, your study found that men really don't want to talk too much about their health. Why do you think that is?
Correct. So from past years, we knew men really were not talking about their health. This year, we actually included women, their spouses, in the surveys to understand, are they talking to their wives? And they're not. So the reasons behind that, really, that's the million-dollar question. But our hope is that with this campaign and with raising awareness that this is, potentially a problem, that we'll start sparking some conversations and sparking some dialogue at home so that men open up about some of their concerns and symptoms.
And the problem is that it's not just the bad stuff, it's any stuff. If a guy goes and has a physical and gets a relatively clean bill of health and comes back, that doesn't even get mentioned. It's just that there's not that dialogue between men and women and spouses and partners particularly that's so important.
Correct. And really it doesn't have to be a spouse. If a man is more comfortable talking to a friend or a sibling, we just want them talking.
So we want them talking as a first step, right? But then eventually what we really want them is to take a step forward toward improving their health. That's the bottom line here, isn't it?
Correct. So our hope is that they might bring up a symptom or a concern that they have, and their wife or their friend or anybody in their support network say, why don't you make an appointment and get this addressed? And I think that's what we're really trying to tap into.
So how do we bridge that gap? Because it is obviously a real problem for a lot of men, and I'm not going to play sociologist here and try and figure out what the wellspring of all this is. We recognize there's a problem. How do we fix it?
Right. So we need to get the men in the door, and I think that's what this campaign is really trying to look at.
Of the doctor's office?
How can we get them in the door? Right.
Okay.
Correct. And then, it's our job to make the patient feel comfortable and be able to talk about concerns, whether they be concerns that might be embarrassing to them, like their sexual function or urination problems, and really getting them to open up and then try to understand some of the underlying causes and reassure them that we have treatments.
You're on the front line of exactly those kind of symptoms. When you see a male patient, is it difficult to get that guy to say, okay, yes, I am having a problem with X? I mean, is it the pulling teeth even when you get him into the doctor's office?
Sometimes, but I do feel like once they get in your office, they sit down and they're there, that they often will talk. And at that point, we can really start to understand underlying causes and offer them treatments.
Yeah. All right, so how can we as women, as partners of men, help our men to take a step forward toward getting better health?
Right, great question. So I think asking them questions, do they have any concerns, and just trying to get them to talk about it, and if they do, to try to help arrange appointments. A lot of my patients tell me that their wives were the ones that made the appointment for them, just told them where to show up, and that's fine. Whatever will get them there.
All right, that'll work for some men. Dr. Sarah Vidge is a urologist with the Cleveland Clinic, and we thank you for your time today. Important topic.
Thank you. Thanks for having me.
Now we've got an important consumer alert.